Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and today we're going to continue having a discussion about adult orthodontics, but we're going to talk about something that actually affects adults and children, more prevalent in adults, but sometimes can occur. And the question sometimes patients will ask, or people who come into the office will ask is, do I need a night guard? And what they're asking for is, the question is some people come into the office and they're experiencing some tooth soreness, some jaw soreness, some muscle aches in the morning. And this is the first indication that this person or you may be suffering from what we call bruxism. Bruxism is a fancy term of saying grinding, but a lot of people suffer from grinding of their teeth, and that usually occurs at night. And it's something that occurs without necessarily you're actually aware of it. And so the question again is, how do I deal with this soreness and what can I do? And so one of the ways to combat this is the actual use of a night guard. And so night guards offer protection for people against grinding. And so the night guard isn't designed to cure bruxism. And that's a false claim by people that if I gave you a night guard, that's going to cure your ability to grind your teeth. What it does is it actually saves your teeth from grinding down and wearing down over time. So it's actually a different purpose to have a night guard. So a night guard in our office, when we use it and we prescribe it for you, what we're trying to do is we're trying to prevent or preserve your natural teeth in their original shapes and size. And so when we're looking at people and what they experience, a lot of times at night people will clench their teeth and then they'll start to move their upper teeth back and forth against each other, and that'll cause the erosion or the attrition of the teeth. And so by putting in a night guard at night, what we do is we combat your ability to grind on your teeth, and we actually protect them. And so that's the first way of dealing with bruxism. Another mechanism for people who can't tolerate a night guard is to actually look at the positions of the teeth. So sometimes one of the ways to combat bruxism or grinding is if you have misaligned teeth, you actually want to go ahead and get them fixed and get them straightened out with orthodontic treatment. And so that would be our mechanism number 2 of how to deal with bruxism, is that you could elect to actually do orthodontic treatment to correct your misaligned teeth, and that'll actually give you the ability to maybe create a different sensory proprioception of how your teeth come together, and that could inevitably cause you to stop your bruxism or at least alleviate the damage that you do by the continuous grinding that you do. So those are 2 ways that we can deal with bruxism. And the third way, which is a little bit more different, is you actually change your diet or sometimes use medication to actually treat it. The third mechanism is something that I think we tend to push to other realms of medicine, but what we want to do, for at least in the orthodontic practice, is we want to give you the ability to use a night guard or to straighten out your teeth in order to protect against soreness of your jaw and correcting the grinding or bruxism, as we technically called it. Okay, so I hope this information gives you a little bit of information on why a night guard may be prescribed by an orthodontist or your dentist, but we really look forward to seeing you. And if you have any questions about a night guard, give us a call, and we'll see you next time at our next Friday Focus.